Hi, my name is Indira, and I'm going to be doing my assessment on my little brother, Amir.
Yeah, hi.
And we're going to start with the shoulders. And what I'm doing is I'm inspecting his shoulders. I'm looking for any signs of deformities, asymmetry, any swelling, or anything unusual. Next, I'm going to palpate. Amir, do you have any pain,
No.
tenderness?
No.
And I don't see any swelling. Next, we're going to test the range of motion. And I'm going to start with flexion, and then extension, and then abduction, and then adduction, and then I'm going to ask him to place his arm behind his back. Now the other one. Good. And now I'm going to ask him to pretend like you're brushing your hair. Now the other side. Good. Next, I'm going to be assessing his elbow. Relax. I'm holding it at a 70-degree angle, and again, I'm looking for any swellingness, any tenderness, any out. And to test the range of motion of his elbows, I'm going to ask him for flexion to bend his elbows. Bend your elbows on. And then I'm going to ask him to straighten his elbows for extension. For supination, I'm going to ask him to put his palms up, and then pronation, put his palms down. And I don't see any abnormalities. Next, I'm going to look at his wrists and his hands, and let me see the other one. And they seem to be normal, no deformities, no swelling. Do you have any tenderness?
No, I like that.
And then I'm going to be palpating all the way down his fingers for anything abnormal, and I don't see any abnormalities. Next, I'm going to have him do a couple of exercises for me. For flexion, I'm going to ask him to point his fingers to the floor, extension to the ceilings, and then I'm going to ask him for adduction, I'm going to ask him to bring his fingers towards the midline, and then abduction, fingers away from the midline. Next, I'm going to be assessing his spine. Can you turn around for me? And I'm first looking for any abnormalities, any swelling, anything that isn't bilaterally equal, and I don't see anything abnormal. I'm going to ask him to do some range of motion exercises for me. Starting with flexion, I'm going to ask him to touch his chin to his chest, and then extension. Can you look at the ceiling? And then for rotation, can you look over one shoulder? Now the other one? Good. And then for lateral bending, I'm going to ask him to bring his ear to his shoulder. Now the other way? Good. And now I'm going to ask him to bend over for his spinal column for flexion to touch his toes. Touch your toes. Good. Now I need him for extension to bend backwards. Good. And for rotation, can you go like this? From side to side. And then for lateral bending, can you go like this? Now the other way. Good.
Well, goodbye.
Abnormalities or deformities, and I don't see any. Next, I'm going to ask him to do a couple of exercises. Go. For this next step, I am watching my patient. I'm doing the inspection, sit right there, of my patient's hips, and that begins with a careful observation of the patient's gait on entering the room. And that starts with the observation of the two phases of gait. The first, stance when the foot is on the ground and bears weight, which is 60% of the walking cycle. The swing when the foot moves forward and does not bear weight, which is 40% of the cycle. I'm observing the gait for the width of the base, the shift of the pelvis, and flexion of the knee. The width of the base should be 2 to 4 inches from heel to heel. Normal gait has a smooth, continuous rhythm achieved in both part by contraction of the abductors of the weight-bearing limb. Abductor contraction stabilizes the pelvis and helps maintain balance, raising the opposite hip. The knee should be flexed throughout the stance phase except when the heel strikes the ground to counterpart the motion at the ankle. The ankle should dorsiflex so the foot does not drag the ground during the swing phase. Next, I'm going to palpate his hips, and I'm going to palpate the surface landmarks of the hip on the anterior aspects of the hips. I'm going to start with the iliac crest at the upper margin of the pelvis. I'm going to follow downwards anterior curve and locate the iliac tubercle. And then marking the widest part of the crest and continuing tracking downwards to the anterior superior iliac spine, I'm going to place my thumbs on the anterior superior spine, and I'm going to move my fingers downwards to the great trochanter of the femur. And then his pubic symphysis would be right here. And to test the range of motion, I'm going to have, can you bend your knee to your chest? Can you go like this? And then for extension, go like this. Good. And then for abduction, I'm going to move your leg over. Good. Scoot back a little. Scoot back. So then for abduction, we're going to move the leg away from the midline. And then for abduction, we're going to put the leg back. Can you do that for me? And then back. Good. And then we're going to have him, can you put your knee up like this, and then like this? Here. Can you point? Good. Now the other leg. Good. Now we have to test the opposite. Can you go like this? Like this. Now the other way. Other way. Good. And then I'm going to do a knee assessment. Can you sit right there?
Yes.
Good. I'm going to be, I did this observation when he was walking, and I was observing the alignment and contour of his knee. I'm observing for any atrophy of the quadricep muscles or any loss of the hollows around the patella, any signs of swelling around the joint, and none that I can see. Now I'm palpating. Everything seems normal. No abnormalities. Do you have any pain? Good. And now I'm going to ask, can you swing for flexion? Can you squat?
Yes.
And then for extension, standing up after squatting. Good. Sit for me. And then for internal rotation, I'm going to swing the leg towards the midline. Good. And then external rotation while sitting, swing the leg back away from the midline. And then I'm going to next assess his foot and his ankle, and I'm going to be observing for any deformities, nodules, swelling, calluses, or corn. And I'm going to start the palpation this way, and I'm going to be testing for any bogginess, swellingness, tenderness. I'm going to be feeling around the Achilles tendon for nodules and tenderness, and then palpating the metatarsal joints for tenderness. I'm going to compress the foot between my fingers and exert pressure on the heads of the first and fifth metatarsal. I'm going to do the same thing. No abnormalities. Now I'm going to ask my patient to do some range of motion exercises. Can you point your foot to the floor? Point to the floor. I'm here, like this. Now point up. And then go like this. Like this. Good. And now I'm going to test his cranial nerves. And the third cranial nerve, the ocular motor, it tests the shape of the pupils and reactivity to light. It also raises eyelids. Can you close your eyes? Open them. Good. Next, the trochlear cranial nerve moves the eye down when looking at the nose. Can you look at your nose? Look at your nose.
Okay.
Good. And then the
Here.
trigeminal, I'm gonna ask him, can you clench? Good. And then the Dusens, can you look this way, laterally, and now the other way? Good, no abnormalities. For the facial cranial nerve, can you raise your eyebrows up? Can you smile? Can you frown? Good, no abnormalities there. And for the 8th cranial nerve, which is acoustic, I'm gonna rub my fingers next to his ear. I'm gonna whisper something and ask him to repeat. What did I say?
No.
Good. For the 9th and 10th cranial nerves, I'm going to ask the patient to yawn. Good. And no abnormalities there. His gag reflex is intact. For the accessory, can you shrug your shoulders? Good. And the hypoglossal, can you move your tongue? Good. For the rapid alternating movement assessment, I'm gonna ask him to go like this. Good. And now I'm gonna ask him to, as quick as possible, to tap the balls of his feet to my hands. Good. Next, we're going to do the point-to-point movement. Good. Next, we're going to do the lower extremities, which is the heels to the shin test, like this. Now the other way. One more time. Good. And we're going to assess his gait. Can you walk?
Yes.
Can you walk toe to toe? Good. Keep walking. Good. Now can you walk back on just your toes? Toes. Now just on your heels. Good. And then for the pain, the light touch, I'm going to be touching his extremities, no pain. And then stop on here. And then for the proprioception of the great toe, I'm going to grasp his toes between my finger, my index finger, and my thumb. I'm going to either flex forward or down. I'm going to have him close his eyes and tell me which way I'm flexing. Close your eyes. Good.
Up, down, up, down, down,
Other leg. No looking.
down, up, down.
Good. And then we're going to do this discrimination sensation. I'm going to put an object. Can you turn around for me? Stand up. I'm going to put something in your hands and you tell me what it is without looking, okay?
Telephone,
What is it?
telephone.
Telephone, yes. Can you sit down for me? Next, I'm going to be assessing his deep tendon reflexes, starting with the biceps, the triceps, the patellar, the Achilles, and the plantar. And then I would do that on the other side as well. And that concludes our video. Thank you so much. Say bye.
Bye.